My name is Lily Wilson. This is my final demonstration YouTube exam. I'm here to do CPR on an adult. First, you have to determine if an unconscious adult needs CPR by following these emergency action steps. Check, call, care. You're going to check the scene, then you're going to call 911. You'll check for breathing for no more than 10 seconds. And then you'll quickly check for any severe bleeding, as you'll be pushing all of the blood throughout the body. If the person is not breathing, give care by CPR. The first thing you need to do is get in position. Now this is what I have to work with because my dogs were not having any of it. This is their head, their shoulders, and their upper body. You want to be kneeling by their upper chest. Have your body over yourself so that when you put the palm, the heel of your hand on their sternum, you are directly above. Then you will either knit your fingers or you'll keep them above, but you don't want to be putting extra pressure on the chest. You will do this, you'll do 30 compressions at a rate of 100 compressions per minute. And a good way to tell that is by going 1 and 2 and 3 and 4 and 5 and 6 and 7 and 8 and 9 and 10 and so on. You want your chest compressions to be as even and as rhythmic as possible. You can do this by keeping your arms straight and by not leaving the victim when you're performing CPR. After you do your 30 chest compressions, you're going to give 2 rescue breaths. We do this by using the head tilt chin lift and by blowing for about 1 second. Then you immediately go back to the CPR, to the compressions. 1 and 2 and 3 and 4 and 5 and 6 and 7 and 8 and 9 and 10. Make sure that you see the chest rise when you're giving rescue breaths, and make sure that you are keeping your chest compressions at a rate of above 100 beats per minute. Thank you. That's CPR with an adult. This is my video for CPR on an infant. First, instead of using our whole fists, we're going to use 2 fingers on the center of the chest, and we're going to do about 1.5 inches deep of compressions at the same rate, 100 beats per minute. 1 and 2 and 3 and 4 and 5 and 6 and 7 and 8 and 9 and 10. Just like that. We're also going to give 2 rescue breaths to the infant, just like as we do in adults. Then go back to that 1 and 2 and 3 and 4. Obviously, way more faster getting back between them all. Most importantly, do not stop. Continue doing this until an AED has arrived, medical assistance has arrived, and make sure that you call 911 before. The same steps, emergency action steps, apply with infants. It is check, care, check, call, and care. You're going to check the infant for injuries, you're going to call 911, and then you're going to perform CPR. My last part of this demonstration final is the laceration treatment. A laceration is a cut in the skin which is commonly caused by sharp objects, but can also be from a blunt force splitting the skin. This is exactly what this scar is, a blunt force splitting the skin. Deep lacerations can cut layers of fat, muscle, and damage both nerves and blood vessels. Infection is common when a laceration is not treated properly, and even in the best case scenario, some soft wound lacerations will get infected anyways. And some early signs of that are like yellowing, and that can always be treated with antibiotics. Some general care for open wounds includes controlling the bleeding, preventing infection, and using bandages and dressings. Controlling the bleeding entails finding a bandage. In my case, we used a t-shirt. Find any form of cloth that's absorbent and either apply it with force and with pressure to the wound to stop the bleeding, or tie it around if that's possible on a limb. The next thing is you want to prevent the infection. That's when you're going to wash it out with soap and water. But if it's too deep, only use water. The last part is using dressings and bandages. Dressings is the part that is breathable, absorbent, is the part that's going to go right onto the wound. The bandages is what's going to attach it to your body and hold it down. You want to do all of these things when you're treating a victim with a laceration wound, and then assess once everything is done again, after you've assessed before, that the victim will need stitches or not. And you can do this by seeing if there's arterial bleeding or if there's bones sticking out. If it's something that you don't think that you are able to fix, call 911 and have emergency services help you. Thank you.